Hello, my name is Scott Draper, along with Dylan Fix and David Osler. We are here to discuss one of the most fundamental and widely used motions that our shoulder region performs. This motion refers to the process of shoulder flexion and extension. This motion is used every day in our lives, and we often do not realize it. If we look at a few pictures from various day-to-day activities, it shows this motion. We use it when we walk, run, hike, raise our hand, reach behind us, and so many more. So it may lead to the question of what is shoulder flexion and extension. When examining an individual standing in anatomical position, flexion refers to bringing the arm out in front of you as the picture shows. Extension refers to bringing the arm back to anatomical position. As we move it past the point of anatomical position, this refers to hyperextension. These motions will become clearer as we show examples and break down each part into individual movements. Shoulder flexion and extension are made possible by the glenohumeral joint, more commonly referred to as the shoulder or shoulder joint. This is a ball and socket joint which allows us to have a range of motion in 3 planes and 3 axes of rotation. This ball and socket joint is made up of the head of the humerus and the glenoid fossa, which is located on the scapula. As we perform these movements, the scapula will move a little as well. We will reference these movements, though, when we discuss the musculature of the shoulder. This joint is held together with strong ligaments and tendons, as well as strong pieces of cartilage that serve various functions. In this analysis, we want to focus on the specific motions that were stated earlier, i.e. flexion, extension, and slight hyperextension. That means we will only be focusing on one of the planes of motion and axis of rotation. The movement occurs in the sagittal plane, which means it rotates about the bilateral axis. Now that we have discussed the basics of the shoulder joint and the motion we will examine, we can now shift our focus to the muscles that are involved. In order to simplify it, we will look at the motion with the arm in anatomical position and moving as shown in this example. This is flexion, extension, and bringing it back to hyperextension. These motions can become more complex as we flex the elbow or add rotations to the movement as well. For this reason, we will try and keep it as simple as possible. These motions are made possible by the various muscles referred to as agonists or prime movers, which surround the shoulder joint. These various muscles will help stabilize the joint as well as move the arm and scapula. There are other muscles that assist in this movement, but for the simplicity, we will mainly refer to these agonists that have the largest influence. We will first start with examining the muscles involved in flexion and the positioning of the glenohumeral joint that allows for the greatest range of motion. As a side note, the muscles involved change slightly as the arm undergoes flexion above horizontal. For this reason, we will only list the muscles that are involved in flexion up to horizontal. These muscles are the anterior deltoid, the pectoralis major, the coracobrachialis, and the biceps brachii. Those muscles do the shoulder joint flexion. The infraspinatus and the teres minor externally rotate and stabilize the humeral head, while the serratus anterior and the pectoralis minor abduct the scapula. As these muscles shorten or perform concentric movements, the shoulder will flex as one unit. Now that the arm is out in front of us, we will look at the muscles that help us bring our arm back to anatomical position. We will also look at those muscles that help move our arm past the point and into the state of hyperextension. For extension, we have the pectoralis major, the latissimus dorsi, the teres major, the posterior deltoid, and the long head of the triceps brachii, and those are the ones that do the shoulder extension. The subscapularis reduces external rotation and stabilizes the humeral head, while the pectoralis minor, the fourth section of the trapezius, the subclavius, and the rhomboids reduce elevation and upward rotation of the scapula. Once we are back to anatomical position and go into hyperextension, the posterior deltoid, the latissimus dorsi, and the teres major do that shoulder joint hyperextension, while the pectoralis minor anteriorly tilts the scapula, the levator scapula, and the first and second portions of the trapezius, the subclavius, and the rhomboids slightly elevate the scapula. In flexion, we saw that the muscles concentrically moved because they were forced into shortening in order to counteract the effects of gravity. As the shoulder moves into hyperextension, we again see the muscles counteracting the effects of gravity and concentrically moving. As for extension, as the arm moves back to anatomical position, it is more a passive movement for the muscles listed for extension, and an eccentric movement for those muscles listed in flexion. In order for the muscles we listed in this section to undergo concentric movements, the shoulder would have to be extended against resistance. This could include pulling weight back like in a row machine or pushing some weight behind us. Another way our shoulder would undergo concentric movements would be if we were swinging our arms back with force. These lists may seem long and complicated, but as we look at where each of these muscles are located in relation to the joint and examine their line of pull, it makes sense what motion they produce. This was a very simple analysis of a much more complex motion. Even though we simplified this motion, it still involved multiple muscles doing various things. It shows what an amazing machine our body truly is. Again, this is Dylan Fix, David Osler, and Scott Draper, and we thank you for taking the time to listen to our presentation of flexion and extension of the shoulder joint.